How to administer a rabies vaccination. The rabies virus, rhabdovirus, is a preventable viral disease that is transmitted through the bite or scratch of a rabid animal like dogs, raccoons, bats, skunks and foxes. Rabies infects the victim's central nervous system and affects their brain. While there may be no immediate symptoms, after a few weeks, a person infected with rabies may experience pain, fatigue, headache, fever, body weakness, and irritability. As the disease progresses, more specific symptoms like anxiety, insomnia, confusion, hallucinations, slight or partial paralysis, and difficulty swallowing can occur. If rabies is not treated immediately, it can be fatal. Part 1. Preparing the rabies vaccine, if it is in a vial. 1. Wash your hands thoroughly with antibacterial soap and clean water. This will prevent the transmission of harmful microorganisms. 2. Explain the procedure to the person. This will help to establish trust and cooperation. 3. Prepare the necessary materials for the vaccine. These materials include a rabies vaccine vial, 1 or 3 milliliters syringe with a 1/2-inch needle, cotton balls soaked in alcohol, sterile gloves, puncture-proof container, access to a trash can. 4. Put on sterile gloves. The gloves will prevent the transmission of harmful microorganisms by creating a physical barrier between your hands and the surface it touches. If necessary, replace the syringe needle with a new needle, preferably a gauge 23 to 25 needle that is 1/2 inch long. 5. Look at the package insert. There should be information on the vial's package insert that will help you to determine the appropriate amount of sterile water to be mixed with the rabies vaccine powder in the vial. Once you determine this information, lift the top of the vial to open it. 6. Wipe the top of the sterile water bottle and the vial with cotton balls soaked in alcohol. Do this in a circular manner, starting from the inner to the outer part to eliminate harmful microorganisms. Allow it to dry. 7. Inject the syringe into the rubber on top of the sterile water bottle using your dominant hand. To do this, hold the sterile water bottle upside down using your non-dominant hand. Pull back the plunger to aspirate, or obtain the proper amount of sterile water to be mixed with the vaccine. Make sure that the black line or marker in the plunger is lining with the numbered scale on the syringe to obtain the correct amount of sterile water. Once this is completed, roll the rabies vaccine vial between your palms until it looks clear. This will prevent the vaccine from foaming. 8. Aspirate 1 milliliter of rabies vaccine using a 1 milliliter syringe. To do this, hold the vial upside down with your non-dominant hand and inject the 1 milliliter syringe into the rubber on top of the vial using your dominant hand. Draw back the plunger of the syringe until its black line or marker reaches or lines with 1 milliliter on the numbered scale. Remove the syringe. 9. Check for air bubbles on the syringe. If bubbles are present, tap the syringe with your fingers. The bubbles should just float to the top and disappear. Bubbles in the syringe can make the injection process more painful because it adds to the volume of the content of the syringe. The more volume injected into the muscle, the more painful it is. Part 2. Preparing the rabies vaccine, if it is an ampule. 1. Wash your hands thoroughly with antibacterial soap and clean water. This will prevent the transmission of harmful microorganisms. 2. Explain the procedure to the person. This will help to establish trust and cooperation. 3. Prepare the necessary materials for the vaccine. These materials include a rabies vaccine ampule, 1 or 3 milliliters syringe with a 1/2-inch needle, Cotton balls soaked in alcohol. Sterile gloves. A small, clean cloth. Puncture-proof container. Access to a trash can. 4. Put on sterile gloves. The gloves will prevent the transmission of harmful microorganisms by creating a physical barrier between your hands and the surface it touches. If necessary, replace the syringe needle with a new needle, preferably a gauge 23 to 25 needle that is half an inch long. 5. Locate the neck of the ampule by looking for a black line. Get a small clean cloth and wrap it around the neck of the ampule so that you don't get pricked when you break it. 6. Break the neck of the ampule. Do this by pushing your dominant hand in a downward motion against the ampule. Make sure you discard the broken neck in a puncture-proof container. 7. Aspirate 1 ml of rabies vaccine using a 1 ml syringe. To do this, hold the ampule upside down with your non-dominant hand and inject the 1 ml syringe into the hole using your dominant hand. Draw back the plunger of the syringe until its black line or marker reaches or lines with 1 ml on the numbered scale. Remove the syringe. 8. Check for air bubbles on the syringe. If you find any, tap the syringe with your fingers to make the bubbles to float and disappear. Part 3. Administering the vaccine. 1. Ensure the infected person has been checked for any allergic reactions. Make sure the person has told you or been tested for any allergies to food, dyes, preservatives, or animals. This is an important step, as the rabies vaccine is made up of killed rabies virus, which may cause an allergic reaction. 2. Choose an appropriate injection site. The ideal injection site depends on if you are giving the vaccine to an adult or to a child. For adults, intramuscular injection is on the deltoid muscle, or the rounded muscle on the upper arm near the shoulder. If the child is 3 years or older, the deltoid muscle can be used. For younger children, the vastus lateralis muscle, which is located on the middle, outer sides of the thighs, is used. Before you inject the vaccine, always assess the site for any scars, bruises or swelling. If these are present, use the other arm for adults and use the other thigh for children. 3. Wipe the chosen site with cotton balls soaked in alcohol. Do this by moving from the inner to the outer part of the injection site to eliminate harmful microorganisms. Let the area dry. 4. Pinch the skin using your non-dominant hand and inject the vaccine at a 90-degree angle. Push the plunger using the thumb of your dominant hand. Always pull back the plunger to check if blood appears. This is to make sure that you do not hit a nerve or vein. If blood appears, remove the needle and dispose of it properly. Then, prepare a new injection. If there is no backflow of blood, continue to inject the medication slowly. Pull the syringe out in the same angle you injected it to prevent injury to the muscles. After all of the vaccine is injected and the syringe has been removed, release the pinched skin. 5. Put a cotton ball on the injection site and apply pressure. This will prevent any blood from leaking. Do not rub the area, as this may irritate the injection site. 6. Discard the used syringe and needle in a puncture-proof container. You do not want to prick yourself or put others at risk of being pricked by accident. Throw the cotton balls in the trash can. 7. Remove the sterile gloves and wash your hands thoroughly. Do this with antibacterial soap and clean water. To avoid infections and transmission of diseases, never reuse needles and syringes. Always use a new one for each vaccination. Part 4. Understanding how the vaccine works and its side effects. 1. Be aware of how the vaccine uses antibodies to fight the virus. The rabies vaccine comes from killed rabies virus and is an active immunizing agent that is used to prevent infection caused by rhabdovirus. So, it works by letting the person's body to create its own protection or antibodies against the virus. 2. Do not use a vaccine that has been prepared over 1 hour ago. The two commonly used rabies vaccines are human diploid cell vaccine, HDCV, or rabies vaccine BP Pasteur Mérieux, and purified chick embryo cell, PCEC, rabies vaccine, or Rabipur. They should be stored at a temperature of 2 to 8 degrees Celsius, 36 to 46 degrees Fahrenheit, and must be discarded if they are not used 1 hour after they have been reconstituted or prepared. 3. Get the vaccine after you have been bitten by a rabid animal or ahead of time. Receiving a rabies vaccine once you have been exposed to a rabid animal, e.g., by a bite, scratch, or lick in an open wound, is called post-exposure prophylaxis. But the vaccine can also be taken ahead of time by high-risk persons such as animal handlers, veterinarians, and travelers who will go in places that have a high rate of rabies infection, which is called pre-exposure prophylaxis. For pre-exposure prophylaxis or vaccinations given ahead of time to high-risk persons, 1 milliliter of rabies vaccine is injected in 3 doses, at day 0, first dose, and the day the vaccine is given, 7 and 21, or 28. For post-exposure prophylaxis or vaccinations given when the person is bitten or scratched by a rabid animal, 1 milliliter of human rabies immunoglobulin, HRIG, is given intramuscularly on days 0, 3, 7, and 14. For persons previously immunized, which means they have received 3 doses of pre-exposure prophylaxis, or a complete post-exposure prophylaxis, only human rabies vaccines, such as human diploid cell vaccine, HDCV, or purified chick embryo cell, PCEC, should be given on days 0 and 3, and no human rabies immunoglobulin, HRIG. 4. Make sure you have been vaccinated if you are going to be in areas with animals known to carry rabies. In the U.S., rabid animals like raccoons, foxes, skunks, and bats account for the highest number of cases of rabies passed on to humans. In Canada, rabid animals like foxes, dogs, skunks, bats, cats, cattle, swine, and horses have been known to become infected with the rabies virus. In Africa, Latin America, and Asia, dogs account for the highest number of cases of rabies passed on to humans. 5. Don't be alarmed if redness and swelling occurs at the injection site. This is a normal reaction after a vaccination due to the penetration of the needle or the concentration of the drug at the injection site. Side effects like a fever and a headache are also normal reactions to the vaccine due to the introduction of the killed virus. These symptoms can last for about 24 to 48 hours. 6. Talk to your doctor if any other side effects or an allergic reaction occurs. If you experience any itchiness at the injection site or other parts of the body and a stomach ache, these may be signs of an allergic reaction to the vaccine. Seek medical attention if these reactions occur to prevent a severe allergic reaction. Let your doctor know if you experience any other reactions such as burning, crawling, or itching sensation on the injection site, confusion, diarrhea, dizziness, nausea, chills, fever, and/or headache, irregular heartbeats, joint inflammation, muscle pain, stiffness and weakness, rashes, seizures, shortness of breath, tightness in the chest, swelling of the eyelids or around the person's eyes, vomiting. Part 5. Preventing rabies. 1. Make sure your pets get their rabies vaccination. If your pet is bitten by a rabid animal carrying the rabies virus, the virus is then transmitted to your pet and will increase your risk of getting the virus if you are bitten by your pet. Rabies vaccine for dogs and cats are effective for 3 years. For ferrets, the vaccine is given annually. If you have livestock like sheep, cattle, goats or horses, get them vaccinated. Depending on the vaccine used, the effect can last from 1 to 3 years. 2. Do not let your pets roam free. Instead, provide adequate housing and tall fences so they can roam within a restricted area on your property. This will prevent the likelihood of them getting bitten by other animals carrying the rabies virus. 3. Call local animal control if a wild animal enters your property. Do not attempt to catch or remove the wild animal on your own, as this increases your chances of getting bitten.